So welcome everyone. Welcome to the Society of Thoracic Surgeons Intermax and Pedimacs User Group webinar. It's Wednesday, June 29th, 2022. Appreciate everyone taking time out of their day and logging on today and joining us. Today's going to be a simple Q&A webinar. We have some additional STS staff that are going to go over a few details regarding our AQO meeting. So I just wanted to again say welcome. We do have some updates, as I had mentioned. We have Dr. Rodriguez and Dr. Cantor here on this webinar, and they can also provide any updates if they're available for the dashboards and the outcome analytic tools. And then we'll do a Q&A. So I want to thank the team at UAB for joining today. Thank you everyone for joining. And I'm going to go ahead and run through the COVID-19 update, and then we'll go Emily Conrad, who's the STS manager for patient safety and clinical outcomes. She's on the call with us today, and she'll provide some updates regarding AQO. So as far as COVID-19, the update, it's the same update that we've been doing for the past 2 years. Televisits are encouraged if it's a high in your community, and quality of life surveys may be done over the phone or by email. And then we also are allowing follow-up visits to be done outside of the visit window that you'll see on that follow-up form in the database. What if it is past that, the last date of the follow-up date, then that's okay. Just enter the last date in that follow-up visit window. And then sites have 30 days after the follow-up window due date to enter the data for the COVID-19 exception. I'm gonna switch my slides and I apologize, I only have one screen today, and let Emily Conrad discuss the AQO updates.
Catherine, do you want me to? Oh, you got them? Okay, perfect.
There you go. I apologize for that.
Yeah, no problem at all. All right, hi, I'm Emily Conrad. I help to organize the Advances in Quality and Outcomes, a data managers meeting. And then I also do manage the audit. So if you ever have any questions about the audit, you can contact me for that as well. And I'll put my contact information in the chat here in a moment. So about AQO, we can go to the next slide, Catherine. So AQO is a conference. If you've never heard of it before, it's a conference for our data managers. We cover all 4 of the databases on 3 days. So for Intermax and Pedimacs, it'll be on Wednesday, October 26th, and we will be in Providence, Rhode Island this year. Abstract submission has opened, and the deadline is quickly approaching. So Tuesday, July 5 is the submission deadline. We accept both quality improvement projects and then also scientific abstracts. You can find this link here you can find on our website, and I will put that link in the chat as well. If you do want to submit an abstract, which we would love, it can be presented as either an e-poster, or some presentations also get accepted as an oral presentation. So those are the 2 ways that we use our abstract submission. And then I just wanted to mention that if you do submit one, all authors need to fill out a disclosure form ahead of the submission. So I just wanted to let you know, if you're going to be submitting one, we need all the authors' disclosure information. All right, next slide. So our registration is open for both and in person, and we also have a virtual option. So it's a hybrid meeting. You can see here the difference, or all of the registration pricing. We will have an early bird rate through Friday, August 26th. So if you were say to only need to go to the Intermax Pedimacs session, and you want to go to the meeting live, which we would love, you would register as one track. If you're an abstractor for multiple databases, say you want to go to Intermax and then also adult cardiac, you would probably register for that 2-track. And then if you do multiple, and you also want to go to congenitals session, that would be the multi-day track. The virtual pass for, the virtual pass, for STS members is 300, and then the virtual pass for non-members is 400. And you can, go to the next slide and we can kind of talk through the difference between the in-person meeting and then the virtual pass. So we will have in-person sessions with live Q&A in Providence. And then if you register to go to the in-person meeting, you also get all of the virtual platform access. So you'll get on-demand content that'll be available prior to the live conference. And then while we're at the live meeting, we're going to record all of that, all of those talks, and they'll be available in the AQO archive after the meeting in mid-November. At the meeting, we'll also have a networking reception. It'll be on the same evening as your session. So that'll be a great opportunity to speak with, the speakers, the vendors, your colleagues. And after AQO, we will have a hot topics webinar. So if you were a virtual attendee and you weren't able to get, virtual attendees won't have the option to ask live Q&A during the meeting. So that's why we're having this hot topics webinar in January. We'll bring some of the speakers back and you'll be able to have your questions answered.
Okay.
Yeah.
Great.
And then these are just some of the topics that have been discussed on our planning committee calls. So you can take a look here at some things that we were thinking about discussing. And then if you have any suggestions for topics that you would like to see at the meeting, feel free to reach out to myself or Patricia or Catherine, and we will bring it forward to the planning committee. Yeah. And then if you have any questions like case scenarios or anything that you would like to see presented at AQO, you can also submit your questions to this link, which is the clinical question mailbox that you already use. If you have questions, we'll take some information out of there. So if you want to do that, you should do that before Friday, August 16th.
Thanks, Emily.
Yeah, no problem. And then this is just some more information about where the conference will be. It'll be at the Rhode Island Convention Center. This is the first year that AQO has been at a conference center, so we're kind of excited about that. It's connected to the Omni Providence Hotel, and that will be where our room block is. So if you go to register, just make sure to mention that you're with AQO, and you'll get our room block price.
Good deal.
Yep, and that's all. Thanks, Catherine.
Thank you, Emily. I really appreciate you taking the time to do that.
No problem.
To go through that. So.
Catherine, we do have a couple of questions for Emily related to AQO.
Yeah.
So Emily, the first question is from Cindy. Emily, the virtual option doesn't really seem different than buying the slide decks after the fact like we used to. Is that correct?
So I think when you say buying the slide decks after the fact, you might be talking about like AQO Online. So if you are a virtual attendee, you'll get access to the virtual platform, which is different than going to like the AQO archive like we've done in the past. It's going to be more like when we had the virtual meeting the last 2 years. It'll be on a actual platform, a website where you can you'll be able to watch all of the content. You'll be able to download PowerPoint slides. You'll be able to download case scenarios. We'll also have e-posters on there. You'll be able to see a listing of the exhibitors that are there. So I would say it's kind of similar to the last 2 years. The only difference is that it's not going to be a live meeting on that virtual platform. So you won't be able to ask questions while the week that AQO is happening in person. Hopefully that clarifies that.
Yeah, that sounds great. And just, you might have mentioned this, but will there be continuing education credits this year?
There will be for both virtual platform attendees and in-person attendees.
Okay, great.
And Cindy, I see your comment. I'm really sad we can't participate live via Zoom or similar platform. We are going to have an AQO Hot Topics webinar in January. We'll bring some of the speakers back that did present at AQO. So you'll be able to, it'll be a half-day event. So it'll be, say, from 12 p.m. to 4 p.m. So you will be able to still ask some questions to the speakers. It'll just be after you've watched the content that was recorded at the meeting.
Okay, thanks, Emily. If anyone has any more questions, I think before Emily has to depart, please.
I think there's one more from Ashley. So if someone wanted to do both Intermax and general thoracic in person, they're at the same time. So they'd have to choose one and do one virtually. So they wouldn't be able to ask questions or access the content of the virtual one until November.
That is correct.
Okay.
Thanks, Ashley.
Thank you.
No problem.
Okay, great. As far as AQO goes, Patricia, do you have anything you'd like to add? If not, that's fine.
Yeah, no, I don't really have too much to add, just that we've been meeting, we're discussing different topics, and we're really trying to gear it towards you guys, the data managers, and have some great talks and presentations that will be really helpful for you. And we are going to cover some good Pedimacs content also.
Yes, I'm really excited about that. So that'll be really nice. Very nice. Okay, thanks, Emily. Thanks for the link. Emily's put the link in the chat box. So before we move on to our Q&A session today, Rama, do you have any updates? If not, that's fine, regarding the dashboard for Intermax, or any updates to developing the Pedimax dashboard?
Yes, Catherine. Yeah, definitely. Just a quick update on the Pedimax dashboard. We're planning to release the Pedimax dashboard and have a demo at the AQO. So we're working towards that. So we'll have the new Pedimax dashboard ready and do a demo and get any feedback during the AQO conference. So we're all excited to put that together for the Pedimax community, and we're working on that. So that is one update from the dashboard. And as far as Intermax, Catherine, is it okay if I share my screen really quick this day?
Yeah, absolutely. I'll stop so you can.
Thank you.
There you go.
Yeah, thanks. Okay. So for Intermax dashboard, we recently had a version. So this came up during the last users group call. So we updated the site volume to 2021 instead of 2020. And then we also added 30-day and some 90-day adverse event rates and calculations based on 90-day timeline. So all of the initial displays are still 30-day outcomes, whereas we added this device-related infection, which is a 90-day, based on a 90-day timeline after implant, and same thing with driveline infection, which is also a 90-day. So we added these, and also I think under metrics, we added the ICU days in addition to length of stay. So this was the recent updates on the Intermax dashboard. And just really quick, a few comments on the usage. Happy to see that the usage of dashboard and the Kaplan-Meier tool is going up. We see that for the dashboard, for the Intermax dashboard, almost 171 sites used it at least once, and at least 3 times, 153 sites used the dashboard, looked at the dashboard more than 3 times. So that went up from last time, which is good. And for Kaplan-Meier tool, at least 1 request is 104. And then greater than 3 sites that's looked at the Kaplan-Meier tool greater than 3 times is 52. And we see that there are a lot of several sites submitting a lot of Kaplan-Meier requests, Kaplan-Meier generating a lot of Kaplan-Meier diagrams. So there are some sites that generated 51 until now, 43, 41, and there are at least 10 of them that submitted, generated more than 15 Kaplan-Meier diagrams. So we're very happy and to see this continued usage, and we hope that like more of the community starts using these tools and taking advantage of those. So that's the quick update from my side. Thanks, Catherine.
Thank you, Rama. Thank you very much. Very excited about the upcoming Pedimacs dashboard and Kaplan-Meier tools. Ron, did you have any updates regarding the outcome?
Sure, yeah, I have a couple of updates on a couple of topics, and then I'm seeing a bunch of questions in the chat that I'm happy to answer whenever you want me to, Catherine. But for the first update, the QA reports will go out. Maceo from our team will be distributing all those out through the file delivery system by the end of the day tomorrow. One of the things we do, at site request, we will happily go over any of the reports or questions that sites have. So, from time to time, new personnel at sites or just people that need a refresher on how to interpret the result or any questions for, use with their VAD team or QA team, contact us. We're happy to discuss anything. And on each of those calls, I'm really trying to show people how to use the dashboard and or the Kaplan-Meier tool, which is like part of the dashboard, to kind of recreate and understand some of the things in the QA reports, but with a lot more flexibility. You have the ability to really change a lot of things and dive a little bit deeper into that data. So, our team's happy to meet with anyone at a site level to discuss this. If you're trying to use either your QA report or your dashboard or the Kaplan-Meier tool for quality projects at your site, or as you get ready for joint commission or anything like that. Do you want me to go through any of these questions, or how do you want to manage
Yeah, that's fine. We can do that.
Let's see.
Yeah.
I think Jeanette was asking the range of view that's probably related to the dashboard. I know that's something on our kind of wish list for updated versions where it could look at different time spans. I will say the companion tool to the dashboard, the Kaplan-Meier tool, it does allow you to change the date ranges for the comparison cohort and even compare different time windows to each other. So check that out. If you want to reach out to me or anyone on our team, we're happy to walk you through that. How do you get past reports? So unfortunately, our current file delivery system only holds the last report for you to download live, in the system. But if you contact Maceo, he can look up old reports for you. And that's something when we're doing, on our wish list for future editions of Intermax upgrades to be a repository for those reports, so that you have access to historic reports without having to ask our team to send them out to you, because I know that would be helpful, especially if staff change at a site. How do you get those older reports? Maybe that was everything I see there. So if there are any other questions, I'm happy to answer them, but that's everything on my end.
Okay, thanks. thanks. Oh, and thank you so much, Leanne. Yes, I don't believe I covered this, but if you could submit your questions via the Q&A function, that'd be great. But I'll still check the chat just in case. Thank you, Ryan. I really appreciate it. I do have a question for you, Ryan, about the Pedimacs, the outcome analytics. So the Kaplan-Meier curves and all, they will be available for Pedimacs once we launch that.
Yes, it will be a complete mirror of the Intermax, and then we've been working with some of the Pedimacs leadership and our team to, where appropriate, make changes like the volumes and the weight ranges and ages, etc. But there will be a complementary tool like the dashboard and like the Kaplan-Meier tool when that launches.
Okay, great. Jeanette responded, she doesn't believe there's a 30-day readmission on the dashboard option.
So Catherine, I'm just looking at it. There is a readmission screen, which is the third section under adverse events, that shows 30-day readmission stable.
Rama, do you want to screen share that so Jeanette can see?
Sure. Yeah, sure. Yes.
Okay, I'll stop, Rama.
Yeah.
There you go.
Yeah, thanks. Okay. So, yeah. So under adverse events, these are the subsections, and there's a 30-day readmission here, which is like it shows 30. Yeah. Yes. Perfect. Structure.
She actually was referring to the Kaplan-Meier curve.
Oh, okay. I got you.
But I'm glad you shared that, Roma. Thank you.
Sure.
Okay, well, I think we will, let's see, is there one more?
Can I make one comment too? I just saw in the—
Of course.
Jeanette had asked for the previous, how do you get a previous quarter? How do you also download the data for the views? So yes. I'm interpreting that to mean for the QA reports, how do you get the data for that? You do get your site data sets quarterly, and that is the same half of the data that's used to generate all of your site-specific information in the QA reports. You can't download like the whole aggregate Intermax, full Intermax data, but you can download any of your site's data in two ways. One way is, like I said, the quarterly site kind of packet, the site data packet. That's kind of like the reporting and really processed data that is ready to make reports and ready to do different kinds of analytic output. And then there's also the form download tool that allows you to enter instantaneous download, form by form, the exact content questions. So so you do have ways right now that you can download all of your data. So I think that answers that. If it's something else, let me know that you're asking.
And if you're trying to get those older data packets to go along with the reports, if you ask when you email Maceo, or you can email me, this is John Pennington, I create those data sets. I'm happy to get a prior quarter uploaded for you too.
Oh, thanks, John. Great. Hey, Maceo, I see you're on the webinar. You joined. You may be muted, but just to confirm, the site reports, that packet and the data sets will go out tomorrow.
Great.
Okay, great. Thank you. Oh, there you go. Thanks. Thanks, John, for providing your contact information. So now that we've heard from our UAB team, just to let you know, please use the Q&A function for your questions. We'll answer as many questions as possible. We love to hear from you all because you are what make the database so wonderful. We have some resources that you may use for any of the, we have appendices for Intermax and Pedimacs. You'll find the adverse event definitions, the user's guide. We have a video, a training video, which I'm in the process of updating. And if you just a note, if you do need a quality of life survey, we cannot post those on the website, but you can contact Jeannie and Love, and she can provide you with a copy of those quality of life surveys. So just wanted to let everyone know. Thanks everyone for joining. Our next user group call will be July 27th at 1 p.m. Central Time, 2 Eastern Time. And the reporting webinar will actually be July 21st, 2022 at 2 p.m. Central Time. And so the reporting webinar, that's your time to really ask Ryan and his team, John and Rama's part of that group, and Maceo and Chase. Any questions that you'll have about your reports or the data sets or the dashboard or the analytical tools. And again, the reporting webinar is July 21st, 2022. That'll be our next webinar. I think this afternoon, we're just going to have a easy breezy summer Q&A session. So if you have any questions regarding, anything Intermax and Pedimacs, please feel free to answer or ask, sorry, and we'll do our best to answer them. I'll go ahead and start. The first question I see is, will there ever be an open text option for the 6-minute hall walk test where we could detail, for example, the patient declined the walk? I'll go ahead and answer this, and then anyone who would like to add anything, feel free. Currently, we have the ST box, our status box, which I like to just explain. It's just our reasoning of why the variable, the data field's blank. And usually, those can vary from not applicable or patient, could not complete test or incomplete test. We can look into it. I don't believe we've ever had a text box for that. I understand it actually would be nice to put, reason like patient declined the walk. And that's definitely, I'm going to write that down. That's an option we can absolutely add to the ST, the status option for that question. But John or Patricia, if you have anything to add to that, feel free.
Yeah, I was thinking maybe putting in patient refused maybe would be a good option for that. So we could discuss that.
Okay, great.
Yeah.
A status dropdown is an easy implement too. I mean, I'm not opposed, to any kind of notes field if we wanted to add that in addition, but I would say we wouldn't want to put that in as an alternative to putting in the walk time or the status dropdown.
Correct. Thank you. Our next question is from Lori. I am new to Intermax. How should I enter a hemoglobin plasma result of less than 30 milligrams into the Intermax registry, since the system will not allow me to use the less than sign? Thanks. Lori, this question has been asked. It's very frequently. It's actually probably, I think, probably something we can discuss. I can talk to Patricia and John and Rama about maybe figuring out what we can add, because I know that that's an issue. And I'm sure, Patricia, you also get this question frequently.
Yeah, I do get this question. And usually because we don't have symbols allowed in the text box, I just advise people to enter unknown because we don't know what that number is.
Right. Correct. And that's what that is, our suggestion from Patricia and I, especially if it is less than 30, then just to enter unknown. But I know, I would be the same way. I wouldn't want to put unknown because we know it's less than 30. We just don't know the exact number. But that's something definitely I'm writing that down now too. And so we can talk to Rama and his team tomorrow, and Patricia and John and I can talk about seeing how we can fix that. Because I'm sure we could add it to maybe the ST drop down, possibly. I don't know. Yeah. I know we do that with like the Pro BNP. So
Catherine, I think that was my first thought too, that we could add it to the ST drop down. That makes sense. That makes sense too.
Yeah, there's a couple of those labs that have specialty drop downs.
Yeah. Thank you. So thanks, Lori. Thank you for that question. This is from an anonymous attendee, from a new user. Well, welcome to Intermax. Am I required to take the city training to submit data to Intermax? No, Intermax previously required the city training, but you'll have to follow what your site, your institution would like you to do. But I believe Intermax does not, or Pedimacs require you to complete it or submit it to us anymore since 2018, I believe. But Jeannie Ann, or if anyone else has a background on that, feel free to elaborate.
No, that's correct, Catherine.
Thank you. Our next question, as I prepare for our site audit, I wanted to know if documenting in a patient's electronic medical records required, or is records such as the QOL forms okay to just have a paper copy? It is fine. It's just easier in the electronic medical record. You will have to submit that paper copy of the quality of life surveys. So you will have to scan it in and submit it with all your other documents for the audit. I don't know, Emily, if you needed to elaborate.
Yeah, I would just, I'm gonna put the email for Healthcare Management Solutions. They are, HMS is who's doing the audit this year. So I'll just provide some contact information for them. They might be able to help as well.
Okay, thanks, Emily.
Mm-hmm.
Catherine, I can take the next one if you'd like.
Okay, perfect.
Okay, so the question is pericardial tamponade. Should these be filed under major bleed or pericardial effusion? So as you know, our AEs have changed and major bleeding is one of them. So you would have to look at the different types of bleeding. Pericardial tamponade is, can be bleeding, is bleeding. So you'd have to look and see if it meets which type it would meet under. Type, it would probably be type 2, 3A or 3B, or type 5 for fatal bleeding, to see which one it would meet and if it would meet the bleeding definition.
Okay. Thanks, Patricia.
I can take the next one, Catherine, also. Patients are doing the questionnaires at their office visits, but may not ever get scanned into the EMR. I've been marking yes, completed, and then unknown for all the answers until we can get this fixed. Is this the best way to enter the data? So yes, I guess until you can get the answers, you can always go back and you can edit the forms and add them back in there once you do get it scanned in and can see the answers.
Yeah, that, sure. I hope.
Sorry, didn't mean to.
No, go ahead, Brian.
I don't have a better solution, but it is definitely not ideal because a lot of our metrics that say did X, Y, or Z get completed, look at that yes. So in terms of reminding yourself it still needs to get done maybe as a placeholder, but without the content information in there, I'm having trouble thinking through exactly what that's going to do to all of our systems.
And also on that, right, just one option is you could click save for later and leave that leaves the form as in progress, and you can always come back and complete that. That
might be a better option because our programs on reporting and all that kind of stuff is going to try to analyze that form if it's saved.
Right, and in the quality of life surveys, those are such valuable, contain such valuable information on these patients. So I hope you get it, you find your solution soon and can get the data entered into the database. But Rama, that actually sounds like a good option if you could just choose save for later. That way you'll have a reminder to go back and actually enter the data.
Yeah.
Now the downside there, Rama and Catherine Wright, would be if this is a follow-up form, it'll still show on their follow-up forms due because the form's not submitted.
Right. Yes.
Yeah.
It'll be a nice reminder so they can submit it. Well, thank you for the question, and thanks everyone for the answers. And Dan, I'm glad you joined. I actually have an email that I'm going to send you this afternoon. It has some information that you've been wanting. But let's get to your question. I'm relatively new to Intermax. Who typically completes the pre-implant surveys with the patient? Do all sites have the VAD nurse complete these with the patient, or does the abstractor, non-nurse, non-patient care role contact the patient to complete the pre-implant surveys? I'm happy if people would like to just kind of help with Dan's question. I can tell you it's kind of a mixed bag. I know there's many sites that it is the VAD coordinator, the nurse, that does do that with the patient, whether it's when they're in the hospital or at a follow-up visit. And there's plenty of sites that, you know, it's a non-nurse, non-patient care role that also may do it at a follow-up visit, like give it to the patient to complete as they're in the waiting room. But I'm happy to hear some of the sites, y'all's answer to help Dan along. And Patricia, if you have anything to add, great.
Yeah, I don't really have a whole lot to add. It's just that I typically hear of the VAD coordinators doing it at other sites, but I'd be interested to see what everybody else says too.
Yeah.
Oh, it looks like a PA does it.
Okay, our next question. Also, can we discuss a bit more about the other events section under the other serious adverse event form? On a previous call, I recall someone saying they entered G-tubes, ileuses, Dignacare placements here. Is this what you're looking for in this area? I'll start, and then Patricia, feel free to add. Yeah. So usually for that other additional adverse events that is on that form at the bottom, it's usually if it's like a, you know, I'm going to say serious adverse event. So it's usually like if cancer, or if you want to enter like a G-tube placement or an ileus, it's really, if you want to be sure and have all your events documented, you can enter like G-tube placements or ileus there. That's fine. I think more the reasoning was, you know, for a really serious adverse event that you would like to have documented.
Catherine, I completely agree with everything you said. It's something serious going on in the patient. Cancer, pancreatitis, something that's kind of could potentially change the overall picture for the patient.
Thank you, Patricia. So it looks like we have some responses from some sites, and I know these are some coordinators, nurses that have been with Intermax for years, so I'm glad they responded. One says a VAD coordinator, the other one says inpatient VAD coordinator completes the pre-implant forms with the patients. And then another one, and then our VAD coordinators do the questionnaires with the patients and document that they were done, and the forms are MIA. I hope you find those forms and can get them scanned in. And I'll go ahead and read this one. Our patients are registered in ActiCare, and they get notifications through ActiCare to complete the QOL. Most of them are completing after the follow-up window. How do I enter this into Intermax? Well, not ideal, because we'd prefer, you know, they really need to be completed before that, preferably at or before the follow-up visit date. We do, I know we really, and y'all have heard us talk, Patricia and I talk, and John and Ryan and Rama, we've talked about this for years. This quality of life survey data is just so important for these patients. And, it's such good data. We want it. So we're not gonna, preferably, like I said, we'd like it before or on the follow-up visit date. If you want to email me, if you're saying most of your patients, we want this data, so I'm not going to tell you not to enter it. But email me this afternoon and let's figure out like how much after the follow-up window. Like if you have a 3-month follow-up and you have a window from, let's say, June 1st to August 1st, if it's within that time frame, possibly, as long as it's in that big window, but we'll have to discuss it. And Patricia, if you have anything to add, go for it.
I've told some people that if it's in the, in the big window, maybe it is after your follow-up visit, but if it's like a couple weeks later, but it's still in the follow-up window, I feel like it is, if you're talking about a 6-month, it's still applicable. I guess my question would just be like, how late is it?
Yeah, how late is it? Right.
All right.
If you want to, if you wouldn't mind sending me an email this afternoon so we can kind of figure out just how late is it. But that data is so valuable. Ryan, I'm sure you would agree. You'd prefer to have the quality of life data than just if it's completed, not have it. So, and our next question is, did you say earlier that both the EQ5D and the quality of life form needed to be requested via email? No, what I was saying is we're not Intermax or Pedimacs. We cannot post the EQ5D or the KCCQ, the actual surveys on the website. But if you email Jeannie and Love, she can send you a copy of the EQ5D or KCCQ Express, and then you can print it out and make as many copies as you need or do what you need to do with it. I was just saying, yeah, it needs to be, if you need to see those forms, they're not posted on our website, but you can just email Jeannie and Love and she'll get them to you. Okay. Looks like we have some questions into the chat box. So I will start on those. I'm going to make this bigger so everyone can see it. Let's see. We've already gone over the report questions. I think, Ryan, you addressed Jeanette's question about the reports, fourth quarter ability. I think you've already addressed those. Let's see. Here's one. I have a patient who received an EvaHeart, but it was later exchanged to HeartMate 3. I entered the HeartMate 3 implant into Intermax as a primary device and documented the prior VAD. Why is this primary versus secondary? So I guess you're wondering why the EvaHeart was. Felicia, I guess, are you asking why is the HeartMate 3 primary? And the reason it is because the HeartMate 3, I'm assuming that it was implanted on the left side. And that's because for Intermax, if the device is placed on the left side, if it's an LVAD, so the first durable device implanted on the left side that's FDA approved, that's going to be considered your primary device. So if they had the EvaHeart and it was on the right side, or since it was just a temporary device, it cannot be entered as the primary device because it's not a durable LVAD. For Intermax, the durable LVADs, or possibly the durable device, it could be on the right side, but as long as it's a durable device, it needs that will be counted as the primary device. And if you have, Patricia, if you have anything to add to that.
Nope, I don't
You
have
will,
anything.
good. You will need to document that the patient did have that first temporary device. And you can do that in the sections on the pre-implant form. But thank you for your question. Our
Felicia,
physician,
if you
go ahead.
have oh, sorry, Catherine. Yeah,
No,
Felicia, you know, once you get the patient entered in Intermax, if you want me to take a look at it, if you have any questions, you can reach out to me.
Thanks, Patricia. The next one is it's regarding the QOL surveys. Our physician assistant administers our QOL pre-implant, and then Sherry Shorts, she does it herself. And then nursing coordinators. So it looks like it's mostly the VAD coordinators. There is the PA that does it. Again, our nurse VAD coordinator does pre-implant forms when patients completing other paperwork, and then the medical assistants help to complete at clinic for post-implant. And then at Jeremy's side, it's the data analyst. Sheila's side, it's the VAD nurse practitioner, or the PA does them, or the research coordinator. And then Rebecca says the VAD engineers do the QOL surveys and 6-minute logs. And then Sheena, hey Sheena, hey friend. We're trying to get it built into Epic, hoping it can be shared for all hospitals who use this EMR once complete. So I'm assuming that's for the quality of life surveys also. And then Jeannie Ann, thank you for your email. You can email Jeannie Ann if you do need a copy of the quality of life surveys. Oh, Eva Hart's a durable LVAD. Thank you, Felicia. So you're using it as a durable. Well, then if it's the durable LVAD, it would be primary. But my suggestion is I would then just try to delete everything I said earlier about it being temporary. And I would suggest, thanks Patricia for volunteering to assist Felicia. And Felicia, if you work with Patricia, we'll definitely get this patient tidied up. And if we have to delete some forms, or Rama's team may have to help us, but we'll get it fixed correctly, entered correctly. So let's see if there's another question. On the pre-implant form under payer, what should I select for Anthem Medicare replacement? I believe there's and I'm trying to think, I don't have the forms in front of me. I think there may be a primary. I don't know, that's a tricky one because it's Anthem, but it is Medicare.
I know, I'm looking at the options now. The choices are government health insurance, but it's Anthem. Commercial health insurance, HMO. I don't know. That's a tricky one.
I'm thinking, I don't think, I mean, that's the stick. It's, you know, since it is Medicare, it could be government, but it's Anthem. So I don't think that would probably be appropriate. But is there another option or no?
There's an unknown.
Okay.
Yeah, there's an unknown.
Well, this is where, thanks for bringing this up, because I'm going to write this, I'm writing this down so we can talk to Rama and his team, and maybe we can add an option. But I would think, since there is not an option really at this time, I would probably go ahead and just do government. That's going to be the closest to what your closest choice available now. And we'll see what we can enter, what we can add, if we can add anything to the database to help you. Okay, well, does anyone else have any more questions? I know we're almost out of time. I do want to just tell everyone thank you, especially during the summer. Thank you for taking the time to log on to our webinar today. Thank you, Emily, for joining, and the other STS staff, Leanne, Addie, and thank you to the UAB team, Rama and Ryan and John and Maceo, Jeannie Ann and Chase.
Great call, Catherine.
Thank you, Catherine.
Thanks,
Good
everyone.
job.
Y'all have a really good day and stay hydrated.
Yes, ma'am.
You too.
Have a great summer, everyone. Thank you.
Thanks, everyone. Bye-bye.
Thanks. Bye-bye.